them and not show them, but a way to have a different and a slower relationship with these kinds of objects. Okay, so that's my patient. I'm now going to move on to the disease. I started off with this provocative statement that the medical museum could be seen as an ailing patient in the contemporary world who needs an injection of art. So what's the disease? And I want to push my metaphor a little bit further and say that this disease is due to, of course, the environment, the interactions of genetics and environmental factors. These is both about what the museum is, for example, the collections it holds, but also about the environment in which it lives and how that's changing for us today. And I want to present two problems that we might focus on in this diagnostic process. The first is that medicine itself, and therefore the body, have changed. Not changed completely, of course, but changed in some really important ways for thinking about this setting. And I'm just going to read you this quote, which is by the museum director, Thomas Söderqvist, and our head of exhibitions, Bente Ving-Pedersen. And they wrote in a recent volume on medical museums in the chapter about our institution, developments in biochemistry, molecular and cell biology, in imaging and information technology, and in genetics and genomics are fundamentally transforming medical research, clinical practice, the pharmaceutical and devices industries, and not least, the status of the patient and the politics of health, what it is to be a patient, to have a body, to have a sick body, and to be treated. So what does this mean? Why is this a problem? As I hope to illustrate with this gene chip here, the objects become less somehow suitable for exhibitions. If you compare it to the surgical saw that I showed earlier, or the dramatic accumulation of the dentist prodders and pokers, and particularly the anatomical specimens and beautiful waxworks, these objects are less effective and bodily. They don't hit us in the same way. They're not on the same scale for us as a body meeting another body, or meeting a tool that seems to directly relate to our bodies. And they're less easy to explain. To some degree, this is just a challenge of skill of communication, but there's also something really deep going on here, I think, about our expectations about what objects should be in museums. This is, of course, a challenge for changing exhibition practice rather than something to just throw our hands up and say, these things are ugly and cold, as opposed to the things of our past. But it undoubtedly poses a problem for display. It also poses extra dilemmas for collecting, as objects and the things which comprise